Respiratory failure is when the lungs fails to perform its own function, that is gaseous exchange or oxygenating the deoxygenated blood. Now this respiratory failure can be of 4 types, type 1 all the way to type 4. In this video, let us talk about the type 1 respiratory failure, which is also known as acute hypoxemic respiratory failure. So the underlying main pathophysiology over here will be your hypoxemia. Now for that, we have to first understand the basic physiology or physiological parameter that is under play over here. That is, first the air that is entering into the alveoli, that air contains oxygen, and this process over here is known as the ventilation. Along the alveoli there is presence of dense capillary network, and that dense capillary network contains blood. So over here something known as the blood flow, and this blood flow is what we call as perfusion. Right? Now the ratio of ventilation is to perfusion is known as ventilation perfusion ratio. So we mark ventilation by V and perfusion by Q, and what we get is a V by Q ratio, that is ventilation by perfusion ratio. Now suppose there is an alveoli in which we have water within it. Now this water containing situation can be as in case of pulmonary edema, or there can be consolidation as in case of pneumonia, which will lead to consolidation, right? Or there can be, or even in case of ARDS, you can see this kind of a situation. In that case, the oxygen that is getting dissolved into the water is quite less, and hence over here the amount of oxygen that is available for diffusion or exchange is very low. In that case, what is happening? The ventilation is low for a normal level of perfusion. In that case, there is something known as a VQ mismatch, and this VQ mismatch, having less amount of ventilation or less amount of oxygen, is causing the hypoxemia. This ventilation perfusion mismatch has less amount of oxygen in blood and leading to hypoxemia. So this is your mechanism 1, that is a VQ mismatch. Now there can be a second scenario. What is that second scenario? Suppose in some part of the alveoli there is no water or consolidation there, rather suppose this part of the alveoli is well and good, but what's happening is that over here the exchange membrane that we have has got thickened. This is the exchange membrane, but the exchange membrane has got thickened. Thickening of exchange diffusion membrane. Right, thickening of diffusion membrane. In that case, the oxygen that is getting diffused, oxygen diffusion, is again low. Again there's low oxygen coming to blood, and that is leading to hypoxemia. Low O2 in blood, that is leading to hypoxemia. This is your mechanism number 2. Now there can be a third mechanism, that is there can be a regional alveolar hypoventilation. Suppose in one particular alveoli the air entry itself, the air that is entering this alveoli is less in amount. So this alveoli has decreased ventilation in regional alveoli. Some regions of the lung, the alveoli present over there, are getting less amount of ventilation. In that case, the oxygen in the alveoli is low, low O2 in alveoli. So decreased O2 will go to blood, and that will lead to hypoxemia. This is the mechanism number 3. And there can be something known as a mechanism number 4. How is that possible? Over here, blood getting bypassed before exchange. If blood is getting bypassed before exchange, decrease amount of O2 in blood, and that is causing your hypoxemia. This can be seen in case of atrioventricular arteriovenous shunts, AV shunts, abnormal AV shunts. So this is your mechanism number 4. So there are 4 mechanisms that we have discussed which can lead to respiratory failure, which is hypoxemic respiratory failure, and also known as the type 1 respiratory failure.